They are the only center in Arizona and just one of 10 sites nationwide that is investigating the first ever artificial meniscus implant. And for one patient who has undergone this procedure, he's able to live a life he thought was gone forever.
I was thinking about early retirement. I was going to retire, and because I didn't think I could do my job anymore, and now I don't have to. I can work for another 9 years instead of having to retire in 4. So yeah, it's changed my life immensely.
And Robert's life-changing procedure started in a new clinical study here at the Orthopedic Clinic Association, or TOCA, in Phoenix.
The SUN trial has been developed over in Europe, so it has a track record back to 2008, and it's to fit that void that we have right now between, okay, you're taking medications, PT versus knee replacement. That void is purposed to put this implant in.
The trial is evaluating the first ever artificial meniscus for people with persistent knee pain caused by injured or deteriorating meniscus cartilage.
Well, the model we have here is, if you look, there are 2 meniscus. There's C-shaped cushions inside the knee. You have the outside, which we call lateral, and the medial, which is what this trial is for. You have to have a normal lateral meniscus, just the medial side, because that's where vast majority of them are torn. So the implant, it's actually quite simple. When you have no meniscus, as you can see, there's no cushion. So what this is, you do an arthroscopy to make sure you're a candidate. You make about a 4 to 5 centimeter incision, and you basically insert this, and it fits. As soon as it comes in, it pops in. So there's not any cement that's required, such as a total joint or any suturing. You have to be between 30 and 75. The most important thing that I stress to people out there, it's not meant for those that need a knee replacement. There's a lot of people looking for an answer that we still don't have. So it has to be symptomatic. You have to have mild to moderate arthritis, but not severe arthritis. This is one beforehand. This is a normal meniscus, in this case the outside or lateral. This is the inside where he had it excised. So after he did this, you can see now the implant that fills in that gap compared to beforehand.
After 2 injuries and 3 surgeries later, the consistent pain in Robert's right knee kept him from the active lifestyle he loves.
But after the leg was over, I took the wrappings off and pain started and swelling, and it hurt to walk, hurt to climb stairs, it hurt all the time.
Since his knee wasn't purely arthritic and he didn't need a total knee replacement, Robert qualified for the SUN trial.
What I liked about the SUN trial was that they weren't going to take anything out that couldn't be replaced. They were going to put something in. That was the first thing. The second thing was that there's no staples or sutures or bolts. Nothing holds it in other than your biomechanics, which to me sounded awesome. You know, my meniscus and the 2 bones that make up the lower and upper part of that knee joint are what hold it in place. So it was perfect for me.
And months after the surgery, Robert is back to the great outdoors and living life pain-free.
The pain that I was suffering prior to the implant is gone. And as soon as the swelling was down and the knee started to return to normal, that's the first thing I noticed, that the impact pain that I felt was no longer there. It used to radiate down my shin from the knee, and that's just gone. It's as if the cushion is just replaced.
If you want to learn more and find out if you're eligible for this study, visit their website, sun-trial.com, or call the number on your screen.